having trouble getting your baby to bottle feed? In this video, I'm going to show you exactly how to conquer tongue ties and get your baby bottle feeding like a pro in no time. 1. What is a tongue tie? A tongue tie is a medical term for a condition in which the thin piece of tissue that connects the underside of the tongue to the floor of the mouth is shorter than usual. It can cause difficulty with breastfeeding, in bottle feeding, speech delays, and other problems. 2. What are some signs your baby may have a tongue tie? Signs that your baby may have a tongue tie include poor latch during breastfeeding or bottle feeding, clicking sounds while sucking on a bottle or breast, excessive drooling, fussiness during feedings, constant hunger due to not getting enough milk from the breast or bottle, gagging or choking after suckling for a period of time, frequent hiccups during feedings, and frequent nursing breaks due to fatigue. 2. How do I know if my baby has a tongue tie? There are several signs that can suggest your baby has a tongue tie. The main indicators include difficulty latching on the breast or bottle, clicking noises while nursing or bottle feeding, and poor weight gain despite adequate calorie intake. In addition, you may notice that your baby's tongue appears heart-shaped when they stick it out of their mouth. If you suspect your baby may have a tongue tie, it is best to consult with a pediatrician or lactation specialist for confirmation and diagnosis. Treatment options will depend on the severity of the issue but often involve surgical procedures such as LACE or frenectomy to help correct the problem and improve feeding success. 3. What are the effects of a tongue tie on bottle feeding? A tongue tie can have a serious impact on bottle feeding. It can make it difficult for the baby to properly latch onto the bottle, resulting in a poor seal and inefficient feed. This can lead to her swallowing, gas, colic, reflux, and aspirated milk into the lungs. In severe cases, it may cause poor weight gain or even malnutrition if not addressed early. Additionally, babies with tongue ties often tire quickly while trying to feed and may become frustrated when they are unable to get enough milk out of the bottle. As such, proper diagnosis and timely treatment are essential for successful bottle feeding with a tongue-tied baby. While there is no one-size-fits-all solution, there are many ways to manage this condition, including dietary changes, positioning techniques, and the use of specialized nipples. With the right approach, you can help your baby bottle feed like a pro. 4. Are there any risks associated with treating the condition? Yes, there are potential risks associated with treating tongue ties. Bleeding and infection may occur if oral tissues are cut during treatment. It is also possible for the tongue to become swollen or inflamed after a release procedure. If severe pain persists following treatment, see your doctor immediately. Additionally, it is important to note that not all babies with tongue ties will require treatment. In some cases, the condition can be managed without surgery with special positioning of the baby and physical therapy exercises for the mother and baby. However, if bottle feeding remains difficult after trying various positioning techniques and exercises, then seeking medical help may be necessary. 5. How can I help my baby learn to bottle feed despite having a tongue tie? In order to help your baby learn to bottle feed despite having a tongue tie, it's important to keep in mind that some babies just need more time and patience than others. As frustrating as it can be, try not to get discouraged if progress seems slow. Here are some tips for helping your baby bottle feed with a tongue tie. Change the angle of the bottle. Trying different angles can make all the difference. Try slightly tilting the bottle up or down depending on what feels most comfortable for your baby. Use an anti-colic nipple. Using a specially designed anti-colic nipple can help reduce air intake, which in turn can make feeding easier for your baby. Offer smaller amounts of milk. If your baby is having trouble with larger amounts of milk, try offering smaller amounts to make the process easier. Be patient and encouraging. With anything, practice makes perfect. It may take some time for your baby to get used to bottle feeding, but rewarding progress and being patient can go a long way. 6. Is it possible for babies to overcome a lack of mobility in their tongues caused by the condition and still successfully bottle feed? Yes, it is possible for babies with limited tongue mobility due to tongue ties to still successfully bottle feed. There are various strategies and techniques that can help babies with tongue tie to overcome the difficulty of feeding from a bottle. For example, Using slower flow nipples and pausing during feeding sessions may give your baby more time to adapt and successfully latch on properly. Additionally, positioning your baby in an upright position with its head slightly tilted back can help them adjust better and get used to the sensation of drinking from a bottle. 7. What steps should be taken after diagnosis of the condition in order to ensure that your baby can learn to bottle feed effectively and safely? Once a tongue tie is diagnosed, treatment will depend on the severity of the condition and your own preferences. In some cases, it may be possible to simply monitor the baby's progress with bottle feeding in order to make sure that they don't develop any negative habits associated with the condition. If there are signs of difficulty, then further steps can be taken. We hope this video has helped you understand the signs and symptoms of tongue tie, as well as how to get your baby bottle feeding like a pro. If you have any further questions or would like more information on how to address tongue ties in babies, please comment below. Don't forget to subscribe for more helpful tips and advice. Thanks for watching.